Welcome to the cause of yellow teeth, genetics. There are several reasons for yellow teeth. Dietary changes, age, and medications are among them. However, genetics plays a major role in tooth color. Genetics is difficult to control. However, if you have certain medical conditions, your teeth may get affected prematurely. Genetics is one of the most common causes of yellow teeth. If you have this condition, it is important to take steps to prevent it from recurring. Tannins. The pigments found in certain types of food and drinks called tannins can lead to discoloration of the teeth. Because the enamel of teeth is naturally porous, substances that stick to it can cause permanent discoloration. The tannins found in drinks and food tend to stick to these cracks, so regular exposure to them can cause discoloration of the teeth. The tannins present in food and drink give them their color, while they also impart a bitter taste. Originally, tannins were used in the leather industry to color hides. Consuming alcohol can cause discoloration of teeth. Consuming excessive amounts of alcohol can contribute to teeth discoloration. It can also cause staining. Many red and white wines contain tannins, which wear down the enamel and make teeth more susceptible to stains. Likewise, foods that contain acidic components like tomato sauce, tea, and coffee can cause staining. So, it's best to avoid these beverages altogether unless you want to have bright teeth. Consuming too much acidic drinks is also a major cause of discoloration. These drinks contain tannins, which are a discoloring agent for the teeth. However, by cutting down on your acidic intake, you can minimize the risk of discoloration. Another culprit of teeth discoloration is smoking, which discolors the enamel. Although nicotine itself does not stain the teeth, the combination of nicotine and oxygen causes discoloration. Also, the tobacco residue deposited on the mouth, known as tar, is another contributing factor to tooth discoloration. Dietary changes. Some medications and certain foods can stain the teeth and cause discoloration. For example, some antibiotics, such as penicillin, can affect the development of enamel in young children. In addition, antihistamines and blood pressure medications can stain teeth. In addition, some illnesses, such as pregnancy, can cause discoloration of teeth. Other factors can also contribute to yellowing of teeth, such as gum disease. Some people have a genetic predisposition to yellow teeth. A person's teeth consist of white enamel on top and a yellowish layer underneath called dentin. People with yellow teeth have a tendency to have enamel that is too thin. As a result, the dentin is exposed. However, there are ways to keep teeth white. A proper oral hygiene routine and diet can help prevent discoloration and improve your oral health. Avoid foods that can cause teeth discoloration, such as curry. The intense pigmentation found in this dish can discolor teeth over time. If you want to prevent this stains, mix your curry with fresh fruits and vegetables. Aside from the curry itself, ketchup can also stain your teeth. If you do eat curry regularly, be sure to take care of your teeth and dietary habits. They can also contribute to a person's risk of developing an eating disorder, such as bulimia. Age? There are many factors that contribute to the yellowing of teeth. The aging process naturally discolors the teeth, but there are also several factors you can do to slow down the process. Your age may also be a contributing factor, as well as medications you take, past illnesses, and even certain lifestyle choices. Some medications can even cause your teeth to become discolored, so you'll want to consult with your dentist to discuss your options. Certain illnesses can also lead to yellow teeth. Children with severe neonatal jaundice or high fever may experience this issue. Traumatic accidents, such as falling, can also result in cracked tooth enamel and a grayish hue. In adults, accidents that cause nerve damage can also cause your teeth to appear yellow. Finally, grinding your teeth excessively may also lead to yellow teeth. While it may seem unrelated, some of these problems can lead to discoloration, and you'll want to address them as soon as possible. There are ways to prevent your teeth from becoming discolored, including brushing and flossing. You can also use fluoridated toothpaste. You should also seek out dental care if you're experiencing dry mouth or have other problems with your oral health. Brushing and flossing your teeth daily will help slow down the yellowing process. Grinding your teeth can also contribute to discoloration. For a long-term solution, consider resurfacing your enamel. Medications. Many prescription and non-prescription medications can lead to discoloration of teeth. These medications include antibiotics, antihistamines, and antihypertensive drugs. In addition, certain medications can interact with each other and cause yellow teeth. The use of these drugs should be avoided if possible, especially if you're pregnant. Radiation to the head and neck region can also cause yellowing of teeth. In addition to dental medications, a person's diet can also have a negative effect on their teeth. Some medicines, such as anticoagulants, can reduce the clotting time in the mouth, leading to bleeding during periodontal disease treatment. Others, including smoking cessation products, respiratory inhalants, and cardiovascular medications, can cause a metallic taste in the mouth. Antibiotics, meanwhile, can cause a gray-black cast on teeth. Some common drugs that cause discoloration of teeth include tetracycline antibiotics. Tetracycline can cause tooth discoloration and should be avoided in children and pregnant women. Children who receive this medication while pregnant may experience discoloration of the teeth, even after their baby is born. Antihistamines, such as Benadryl, can also stain teeth. Also, some high blood pressure medications, such as diazepam and esmolol, can cause yellow teeth. Trauma. It is well documented that trauma can lead to discolored teeth, which many people are unable to ignore. Researchers have even found that trauma is associated with more tooth discoloration than other causes. Interestingly, they also discovered that gender, age, and education level were predictive factors of discoloration. So, if you have yellow teeth, it may be a sign of trauma, but it is also not a cause. However, there are ways to prevent discoloration, such as regular brushing and flossing. There are two main causes of yellow teeth: trauma and genetics. Some forms of trauma can lead to permanent discoloration. In children, trauma can affect the development of enamel. It can also lead to bleeding in the pulp chamber. This blood can stain the tubules of the dentin, which run through the tooth's underlayer. When blood or tissue stains the dentin, it causes the tooth to appear discolored. Tooth discoloration is more common in children than in adults. Toddlers tend to fall more often, which leads to more opportunities for teeth to get damaged. Even if the trauma has been minor, the tooth can still be discolored. Once it has healed, though, it is important to visit a dentist to have it checked for decay and any other damage. This way, you can prevent further problems down the road. In addition to trauma, there are other causes of yellow teeth. Periodontal disease. The link between periodontal disease and cardiovascular diseases is still unclear. It has been hypothesized that oral infections may have a role in causing CHD. However, recent findings suggest that oral health may have a role in CVD. According to Elter et al. 6. An edentulous individual has an 1.8-fold greater risk of CHD than an edentulous person without periodontal disease. Although the study was based on a relatively small sample size, it does point to an association between periodontal disease and cardiovascular disease. Among the symptoms of gum disease are discolored teeth. This is because gum disease is a progressive condition. Initially, it begins as gingivitis, a mild form of gum disease, and eventually progresses to periodontitis, the most advanced stage. During this stage, plaque accumulates in pockets between the gums and teeth, which is then filled with yellow tartar. In addition to staining the teeth, gum disease can lead to other health problems, such as bronchitis, liver, and kidney dysfunction. If left untreated, periodontitis can eventually lead to serious tooth damage and gum diseases. Other factors that may cause yellow teeth include poor dental hygiene, pregnancy, or thyroid conditions. If a person has hyperthyroidism, they are at higher risk for developing periodontal disease. Furthermore, some medications and HIV therapies can lead to the discoloration of the teeth. Lastly, a poor oral hygiene and diet can also lead to yellow teeth. But fortunately, it is still possible to prevent this condition entirely. You can start by practicing good oral hygiene habits and getting regular checkups. Genetics. The color of your teeth is largely determined by genetics. The thinner your tooth enamel, the more yellow your teeth will be. Moreover, age is another cause of yellow teeth. As our teeth get older, we wear down our tooth enamel and the yellow dentin will show through. While you can try to whiten your teeth at home, it might not work as well as you would like. So, you should visit a dentist to correct the problem. If you are suffering from yellow teeth, you might want to check out your genetics. If you have a rare disorder like dentinogenesis imperfecta, you may be prone to this discoloration. The inherited condition affects the growth of the tooth enamel and causes your teeth to become yellow or brown. It also makes the teeth brittle and prone to chipping and decay. While there is no cure for this condition, it is treatable and preventable, especially if you can keep your teeth healthy. A dentist will be able to clean your teeth better than you can, and he or she can identify any problems that may be causing your yellow teeth. There are many different causes of yellow teeth, and it is crucial to figure out what exactly is causing yours to become yellow. Genetics can also influence the thickness of the outer layer of teeth, called dentine. The dentine naturally has a yellow color and may be inherited from one or both parents. Thanks for watching. Please like, comment, and subscribe.